Good day, and thank you for joining. I'm Sherilyn Francis with the Georgia Health Information Technology Extension Center. The future of health IT is here. Turn it on. We encourage you to connect with us at www.gahightech.org and via Twitter at Georgia High Tech. Georgia High Tech is the only federal and state-endorsed expert to assist providers in the achievement of meaningful use for EHR technology. We are located at the Morehouse School of Medicine, National Center for Primary Care. And now a few housekeeping measures. As participants, your microphones are muted and shall remain muted through the duration of the presentation. We ask that you check your internet connection. This icon can be found in the upper right corner of your screen. Again, we ask that you check your internet connection for optimal visual and audio experience. We'll ask that you refer all tech questions to the tech support chat pod, and we ask that you refer all presenter questions to the presenter Q&A pod. There will be periodic stopping points for question and answer, and there will be time designated at the conclusion of the webinar for discussion and answers. I now present to you today's webinar entitled Telehealth, Current and Future Implications from a Provider Perspective, presented by Mr. Theo Harvey, Mr. Amin Holmes, and Dr. Jennifer Fennell. In compliance with the ACCME guidelines, none of the speakers have financial or other relationships with the manufacturers of any commercial service discussed in this educational activity. The objectives for today's webinar are to provide attendees with the latest information on telehealth, to provide guidelines to the attendees in the process of starting their own telehealth programs, and to give real-world clinical examples from a provider perspective on the use of telehealth. And now, Mr. Theo Harvey.
Thank you. So everyone, thank you for joining today. We're excited to kind of tell you about some of the latest and greatest that's happening within telehealth. I'm excited today to kind of, explain to you a little bit about what we're seeing in the market, as well as we'll be able to provide some insight from a provider standpoint, someone who's actually using telehealth in their practice currently. So today we're kind of going to just give you an overview of telehealth and give you a sense of some of the definitions so that we're all on the same page. We may skip ahead and go into some of the telehealth benefits, disadvantages, challenges, and barriers. And finally, we're going to kind of end up with a few things about the future of telehealth, right? Where is it going? And talk a little bit about that. So with that being said, kind of talk about the terminology. So the terms have changed over the years. Previously, it was telemedicine, then changed to telehealth, and you may have heard the term called mHealth. Basic telemedicine literally means medicine at a distance, right? And it's been around for a long time, over 40 years ago, right? When they started to kind of initially start with looking at ways to remotely communicate with patients and ensuring that they stay healthy. Some of the initial benefits is just a no-brainer. It just seems as it reduces travel time, cost, and access to specialists, right? Who normally can't get to patients when they need to in an effective manner. What we've seen, what the kind of definition that's been kind of going around there is really coming from ATA, the American Telemedicine Association. And what they've seen is the use of medical information exchange from one site to another via electronic communications to improve a patient's clinical health status. Telemedicine includes a growing variety of applications and services using two-way video, email, smartphones, wireless tools, and other forms of telecommunications technology. So it's just the ability to kind of communicate back and forth between patients and their providers. And the ATA is in the forefront of that. So if you ever went to their website, they give you the latest and greatest when it comes to what's happening in policy when it comes to telehealth, some of the laws that are changing, and then also some of the futures that's coming toward telehealth in the future. So let's get into it. So let's, kind of stay on the same page here. So telemedicine, obviously, it was the first one that was communicated to the field and everyone else. I think the next thing we want to look at is really, understanding. It was really kind of looking at, how do you take care of patients who are sick, right? Really focus on sick care, and it really was used to transmit or diagnose for treatment. But really, we want to kind of use the more inclusive term, which is called telehealth, which is all about making sure the patient stays healthy and preventing them from having to go to the hospital in the first place if possible, and getting those consults that they need effectively and initially in the time and manner that the patients need. Both terms in general are just really talking about telecommunication devices and the transmit of information related to healthcare, and can be used interchangeably. But we're going to focus on telehealth in the purpose of this call. One thing I did want to highlight too is, telecommunications, it's been around for a long time, right? And we do it all the time in our daily lives. But there are unique challenges that are faced, right, when you deal with telehealth in general. So we kind of go into that in more detail and give you a better understanding of how that works. So what are some of the services, that primary care and specialists, can kind of look at when they look at telehealth? Well, one of the first things is really the referral services, right? If you're a physician and you need, consult with specialists to kind of help with certain patients, this is something that could be used, right? And this has been around for a long time. So either you bring the consult in and talk to the patient live and communicate with them, or you kind of have a two-way communication with the patient and kind of get a sense of what they're doing in real time. Really, that live interaction video, or the use of Storm Forward, which in certain states that's available. Fortunately, here in Georgia, there are issues with that. But those are some of the initial ways that physicians have kind of communicated and used telehealth going forward. Remote patient monitoring, including home telehealth. This is one of the key areas, right, that we also want to talk about and really broaden the space when we talk about telehealth. We really want to talk about how utilizing remote sensors and monitors be able to kind of monitor patients, biosigns, right, to get biosigns like the blood glucose or their heart pressure. A lot of these things are very useful in nursing homes, but also in hospitals, right, to prevent readmissions, making sure the patient stays out of the hospital. The ability to kind of incorporate that into the telehealth definition, I think, is going to be key going forward. And then finally, consumer medical and health information. So, consumerization, I'm going to talk a little bit about that, of healthcare in general. That's what's really driving this, right? Consumers say, hey, I can get my food, I can get my, my travel, I can have my fun, why can't I get my healthcare? So the ability to drive medical information, at the time of need, basically in your smartphone. This is something that's driving telehealth. And then finally, education, right? Medical education for the providers, for the patients as well, to ensure that they're being effective and taking care of the health more efficiently. So, really telehealth was really looking at the needs of the underserved populations, right? Brings healthcare services, especially specialty medical care consults to rural areas that unfortunately just not getting the medical services that they need. 1 in 4 of the U.S. population resides in a rural area, so there's definitely a lot of need out there, and that's what kind of telehealth kind of came to the forefront, right? So I think what we can do is kind of look at how that's effective and going forward. Also, gives hospitals opportunity to provide specialty medical care that's cost effective and more convenient for rural patients, especially in areas like in Alaska and other areas. You're definitely going to see it's very difficult for patients to kind of get to where they need to. So video telehealth and other type of needs are really key in making sure that they stay effective. So one of the things, some of the examples that we see, obviously Alaska, what we show is that they do a lot what they call Storm Forward that is reimbursable there. Because of the great distance that they have to travel in Alaska, we have some clients there. They're utilizing services, right, for telehealth to ensure that they kind of meet the needs of their clients who are, effectively looking at different ways of communicating with their patients. Alaska is really key in the forefront of that. Some of the other areas we saw, some large companies have partnered with health insurers like United Healthcare and Cisco, who does things with WebEx. They're providing connected care programs, right, to connect patients in underserved areas to kind of get that primary care physicians and specialists that they need when they need it, right, to provide those tools. And then, of course, here in Georgia, I mean, the Georgia Partnership for Telehealth, they're huge. nonprofit organization that's really has a complete network that's available to provide rural healthcare services to patients that need it at time of need. We'll go into a little bit of what that means from a Georgia standpoint, right? How does that work effectively? But, that's one key area that's really kind of taken off, right? Meeting needs of underserved populations. And right now, what we want to do is take a step back, and one of our clients has been nice enough to kind of communicate, what she sees from telehealth as a practicing psychologist. So I would like to see if Dr. Fennell, are you online? Can you hear us? Well, while she's getting connected. Oh, okay, great. Glad you're here. So, hey everyone. So, Jennifer, thank you for joining today. I got a few questions to kind of ask you as a practicing psychologist and get your perspective on telehealth with the rest of the audience here. So, we thank you for your time today. If you don't mind, kind of let's talk a little bit about, what did you think about telehealth before, before you start using it in your practice? Do you have some insight as to what you thought about it and, what you thought the benefit and maybe some of the challenges could have been? Okay. So looks like we may have lost her in a second. So I will go ahead and move on until we kind of get her back in the session. But while she's getting to
I thought I was back. Am I back?
okay. Yeah, you're back. I can hear you now. Can you hear me?
I can hear and see you. Mm-hmm.
Okay.
Yes,
Great.
I can.
All right. So
Sorry.
let's get to it. So, okay, no problem. So, like I was asking you, can you talk a little bit about, your experience with telehealth before you start using your practice? What were your thoughts about it? And we'd love to get your perspective.
So at first, when I initially looked at telehealth, I thought that it was going to be something that was difficult to use, required a lot of money, a lot of knowledge about using the internet, and that was something that I felt uncomfortable with. Um, and since using it is extremely simple, it's affordable, and my patients in particular really love this format in using it in so many different options. So it has ended up being something that it's like in everyday use in my practice.
No, great. And, when you said it was difficult to kind of utilize and, challenging, so what have you seen now that you're kind of using it in your everyday practice, right? What are some of the benefits that you're seeing from from the patient side and some of the challenges that you're seeing currently with some of your patients as they kind of utilize your services? So I think we may have lost her. So what we'll do is we'll go back to her, and but definitely we'll kind of communicate more what she's seeing from her side of it, because those are some of the challenges that I know a lot of folks are trying to communicate and get a sense of how it works. Um, what we're seeing is, kind of like what she was kind of referring to is, some of these areas, like logistics, right? What are some of the disadvantages and challenges? What we've seen is in the past, it was challenging, right, for having physicians to kind of, meet with their patients and understanding what was the best time to communicate with them. What we've seen is also now currently that a lot of that can be mitigated with, some of the practice management solutions and more effective scheduling, right? I think Jennifer Dr. Fennell kind of referred to it a little bit when she mentioned there were issues, going back and forth with, communicating for patients and, lugging in this big heavy equipment. So, some of those logistics have kind of, moved away from that going forward. Another thing issue is like the provider liability issues, right? So what we're seeing is, you know, um, is a provider, having issues with, their liability, right? What happens if they diagnose the patient? Are they liable? Is there issues with, misdiagnosis when it comes to telehealth? What we're seeing more and more is, medical malpractice does start including telehealth, right? So that you are protected as a provider in the field when you talk to your patients via, these video consults. And then another area, what you're seeing is, maybe, the loss of healing hands, right? So understanding essentially, how do you, sometimes studies have shown that it's effective to kind of talk to the patient, touch them, and getting that warmth connection. One thing we are seeing though is by use of telehealth services, you empower services. Um, some of the other things, definitely the benefits. We kind of talked about this a little bit, access to needed services, right? That's key. I mean, clients are all over the place, and being able to kind of communicate with the physician is going to be key. Obviously, by 2020, there have been studies that have shown that there's going to be a tremendous, primary care doctor and nurse shortage. So telehealth services can help with that, right? To be able to kind of provide those virtual services at need. Cost savings. I mean, is no secret that healthcare costs have exploded in the last year and last several years, decades even, close to 20% of GDP. Looking at roughly about $9,000 per patient that we're paying in healthcare services. So what we're seeing is a lot of issues with that. And then what we're also seeing is improved quality. So what you can kind of get a sense of is what happens if, you have quality issues with the patient, and be able to kind of communicate with them via telehealth that can increase the needs of the patient. Studies have shown telehealth is improving that area, right? Where, having a video consult is the same and similar to having a in-person consult. And then patient interest, we kind of hinted at this, right? The ability to kind of be able to kind of the consumerization of healthcare. Patients are being able to access anything via their smartphones. So why can't they, access healthcare when they need it? And the ability to kind of have the tools to kind of have a video consult, or even, monitoring their chronic conditions via, smartphones and other devices is definitely going to be key for the future of telehealth. Some of the other barriers, that we kind of talked about, interoperability, EHRs, right? Unfortunately, they're great, for kind of digitizing data, but now they become these lock boxes, right? Preventing, access in and outside of them. There are some services, some providers that are looking at adding telehealth services, but usually they're more expensive modules. Or you got to do expensive HL7 integrations, right, to kind of integrate this into your software. One of the promising things is the new FHIR type implementations, where they're looking at, more of a standard across all EHRs to do that interoperability better. So that's still a little ways off. So the ability to kind of integrate effectively your telehealth services into EHR will be key. Licensure. I mean, this is something that's key. If you provide a telehealth consult, are you still, licensed in that state in order to kind of provide that service? So the key ability is, it's a state by state issue. Definitely here in Georgia, there are, restrictions on how you practice telehealth, and ability to kind of look at it from that standpoint as being licensed here in Georgia. Typically, you usually have to have an initial meeting with the patient before you can do a telehealth consult, and obviously it doesn't cross state lines. There is some legislation that is looking at more of a comprehensive, state by state, intrastate communication via telehealth, but still a little ways away. And then, so, those are some of the barriers. And then the two big barriers, we'll talk about a little bit more detail here, is reimbursement, and then talk a little bit about privacy and HIPAA type of situations going forward. So if we look at, the federal law when it comes to, telehealth reimbursement, obviously, this is something that's really key, and it's just very restrictive. I mean, we kind of talked a little bit about the rule, that was been around for 40 years, the ability to have access. But as you can see, because the restrictive nature, which we'll get into in a second, of telehealth, you're only seeing reimbursement really small, right? If you think about it, I think it was 11 or almost 12 million in 2013, and it's only grown, up to, 17 million by 2015. And this is billing Medicare, Medicaid services, right, for telehealth. So it's utilization still low because of the restrictive nature. The hope, obviously, is to increase that over time and make it more effective and accessible for more patients. But until the reimbursements catches up, that's still going to be a ways away before we get to that point. I'm sorry, was there a question? Or okay. So if we move on, so let's look at the state law. So obviously Medicaid is different in every state. What we found from American Telemedicine Association, ATA, 29 states have what they call telemedicine parity laws, right? And these laws state that private payer in that state has to reimburse the same way that you would for in-person medical treatment. So that's important for if you're dealing with medical private insurers and things of that nature. Georgia has been in the forefront of this, right, since 2006, over 10 years in that priority law to ensure that these private insurers will pay for a telehealth consult as if it was a visit. Obviously, you have to have an in-person visit first before you kind of have that, telehealth visit. But then that is something that was leading the way when it comes to that. What we see also, when you look at like reimbursements, high level, Georgia is what we call like a hub and spoke type of environment. So basically you have what they call these distant or hub sites, right, where these physicians or these licensed practitioners, they're delivering these services, right, to all these different patients in different areas of the country. What we're seeing is, they have the originating site or the spoke site, right? These are the places where the patients would come in and kind of have the visit with the patient remotely. These facilities can either be kind of like, a FQHC or a critical access hospital or a skilled nursing facility, even a doctor's office or a nurse practitioner's office, and they can come in and be able to have that visit with that physician remotely. Here in Georgia is unique. There are cases where they can actually we are able to do it in rural school areas as well. So that's one thing that we're kind of leading the country in when it comes to kind of providing these type of originating spoke sites, right? Some of these areas, right, these originating sites, they have to be in what they call HPSA, a health professional shortage area. So basically these are areas, unfortunately, there's not enough physicians, right, to meet the need of the patient population. And so once it's in one of those areas, then the ability for the patients to go to the originate site and be able to kind of have a call with that distant physician is reimbursable. The originate site does get reimbursed, roughly about $29, per visit. And there are some CPT codes that are really available for this type of enactment. But as you can see, it's very restrictive, right? I mean, I think overall across the country, there's only 6,100 HPSAs. Here in Georgia, there are around 60 counties that are, officially looked at as HPSAs. We're looking at Bibb County, Crawford, Monroe. Some of those counties are the ones that are kind of looked at as like having to be in that area. So very restrictive, right? But there is reimbursement available, right, in that Medicare and Medicaid type environment. When you look at Medicaid, definitely looks at it takes that same model for Medicare to apply to Medicaid. Like I said, one thing unique in Georgia is the ability to do those school-based clinics, right, as their originating site. And then also put some frequency on limits on some covered telemedicine services, right? So not all CPT codes are available for that. And then also requires written informed consent and provided on the premises, right? So obviously at that originating site, whether it's a skilled nursing facility or a critical access hospital, there needs to be a practicing physician nearby. So like I said, these rules can get very in the weeds, and if you have any further questions, we can definitely go into more detail with you on a one-on-one basis. But also, as you know, GPT does some of this as well as a nonprofit organization, kind of help you through that process. But it's definitely something that is evolving nature, right? And some of the things we want to kind of showcase is what's going to happen in the future. In private payers, pretty much you build them, right? And there are cases where some private payers are able to pay for telehealth services without even that in front of the patient consult. So those are open as well to some of the telehealth services as well. What we want to talk about too is some of the innovations that are coming down the pipeline. One of the big innovations is what they call the Chronic Care Management Code, or CCM. I think it started beginning of last year. Very early preliminary, but it basically compensates healthcare providers approximately about $40 per month for coordinated care of Medicare patients with 2 or more chronic conditions, medical conditions. So that can definitely add up. But the issue is very restrictive right now, but it's a start in the right direction, right? Remember we talked about, chronic care issues and things to that nature. Those are some of the things that are kind of innovative that they're coming down the pipeline. I think there's some questions here. I'm going to get those questions out in 1 minute as we transition, and I definitely will answer some of your questions. These are great questions. Some restrictions for CCM, we're looking at is definitely Unfortunately, the patient has to pay a copay, right, which is about 20% of that fee. So that could be restrictive. And also, patient has to sign up in order to say this provider is providing these chronic care management services. So that also restricts only one provider can provide this service to this patient. So the patient may have, one primary care physician and multiple specialists. Only one of those providers can provide that service to them. So we definitely feel that definitely is very restrictive right now. But it's a way if you have a large Medicare population that has two more chronic conditions, that could be hypertension, obesity, diabetes. This is a way to kind of monitor them with, telehealth services, right? Including video consults, also remote patient monitoring to ensure that these patients stay healthy and basically, and you can get compensated for that. So that's definitely something that a lot more practices are looking at to kind of, focus in on and moving forward with it. So several questions have come up, so we kind of answer some of these questions here. Take a breather, and thank you guys for the questions, and please don't hesitate to ask us any questions as we go through this. How essential is the current digital infrastructure at my practice if I want to transition to using telehealth? So, definitely, you'd be surprised. There are a lot of innovative ways of providing telehealth now. Via smartphones, digital technology. So everyone has a phone, a smartphone, the ability to kind of communicate that. Also, if you want to do more enterprise level type situation, you can hire, large enterprises to come in and really reshape your infrastructure. Definitely, we can kind of communicate that with you and work with you through that process. Also, if you're in rural areas, GPT does have some initial services that can get you started if you want to get kind of try with it. So I think, those are some of the things that, we can kind of look at, going forward. So we can definitely look at that.
I'm not,
Go ahead.
But I'd like to answer that question too from a clinical standpoint. It's actually much easier than what you would think. It doesn't require, with some programs you can use just your computer or your smartphone. It doesn't require somebody to know a whole lot about technology because believe me, I don't. It's very simple, and as long as I have Wi-Fi, wherever it is I am, I can connect just that easily.
No, that's great feedback. Thank you. Let's take a break here and let's, now that you're back, we love to kind of continue our conversation, along those lines. What else are you seeing, now that you're using telehealth in your practice? What are some of the benefits that you're seeing from the client standpoint and also, from your work standpoint, right? Can you give us some insight into that as well, Dr. Fennell?
So I'm a psychologist, so most of the sessions that I have will take place in my office. You'll come to the office, sit in, and I have allotted 50 minutes of pretty much talk therapy. But now, and what happens a lot is that I have patients who have all kinds of issues to where they can't seem to get on a regular schedule to get into my office. They have children issues, health issues, mental health issues that are getting in the way. And by having a telesession available, they are able to come into my office at times, touch base in person, but the beautiful thing is that regardless of where they are, regardless of if children are home, illnesses are happening, they're able to reach me. They do get charged a fee if they no-show. So this telesession has been a great way of them also staying more compliant with treatment because if they can't come into my office, then they are able to just log into the computer or their smartphone and we can have our telesession right there. Also, I am a trauma specialist, and so a lot of what I do is work with veterans who have pain and trauma as well as sexual trauma. And so being able to use technology and link me into them when they're not with me, we can go through exposure scenarios where they're actually in places and I am live time with them in a HIPAA compliant setting with a headset on. I can walk them through their breathing. We can walk through our steps as opposed to me having to come out of my office as I was trained in old school ways of coming out and actually having a session there with the patient. I'm also able to sometimes use devices that will sync to the programs that I'm using. And even if I'm not physically present or they don't want it where they can see me and I can see them, I'm able to track what's happening to them physically in their bodies and then be able to help them move through the process of exposure. Somebody asked, should I take that question, Theo? Somebody has asked how your patients responded to telehealth. Is that okay if I take that with this section? Wonderfully. They absolutely love it. They miss being able sometimes to come in and see me in person, but we tend to try and structure those sessions around that when they're here in Georgia. And so what happens is as long as they're in a safe place, and that's something that I have to monitor before they get on a telesession, I have access to resources and know where they are physically in case there's any emergency. They have honestly done as good as they would in my office, because those people who are also doing telehealth are very invested in their therapy and also very compliant. It has been a little bit more difficult in foreign countries where I'm doing telehealth because they don't ever get to see me in person, so the process of psychotherapy is a little bit slower. However, I'm still seeing, I've been working with folks now for the past probably 8 months, and I am definitely still seeing some growth to where we back off of sessions. They do a lot more journaling, have a lot more invested in the session, and I think that comes through with how they manage and heal from whatever issue it is that we're working on.
Of course.
I've had maybe one person who had some resistance and prefers to come in, but that's also because a part of their issue is that they have attentional issues. So one of the things I have to remind clients is when we're doing telesessions, I don't want you cooking, I don't want you taking care of the kids, I don't want you driving a car. And it's sometimes harder to maintain focus when you're not sitting in front of somebody and that demand is not direct. But that's only been with maybe 1 out of probably 10 patients that I use this with on a regular, and there's not a lot of resistance. If anything, they're very grateful that there are other options to make psychotherapy something that they can have more regularly as opposed to scheduling it around the chaos of our busy lives.
Hello, Theo. I did want to kind of chime in on the part about the digital infrastructure, if I may. As you were saying earlier, as Theo mentioned earlier, about the different approaches to telehealth, and it varies widely. So you have video sessions, but you also have remote patient monitoring. You also can have EICU, if you're a large facility.
Great.
So it can
I
vary.
think one last question
So
was there initial resistance,
so,
and when
as
you
Dr.
first started
said,
it,
using a
what was
mobile
your take
solution
on
for
that
her
with
works
your
great.
patients when you
She's able
started
to
telehealth
be in
practice?
different places. As long as she has a stable internet connection, she can work. But there may be a case, depending on your goals for your practice, you may need multiple monitors. You may need a very robust internet connection. So have wired lines with maybe a fiber uplink. And so I just wanted to expand that out to say you really want to look at what your goals are and what type of services you're specifically trying to provide to your patient panels, and that will largely govern what your technical infrastructure would need to accommodate.
No, that's great. I appreciate it. Great. So in the interest of time, we're going to move forward, and then we'll cover a couple of questions at the end. But thank you guys for the questions. Please send them in, and we'll get to them. So we talked about chronic care management. That is one way to get additional revenue from telehealth, right? That is outside the normal reimbursement processes. What just came announced recently, last Friday, was MACRA, right? MACRA is basically replacing how providers get reimbursed for providing quality measures. One area, we're obviously not going to get into deep weeds when it comes to MACRA and all the different changes that are happening there. So I'm sure Georgia High Tech will have a session on it later date. We just kind of want to highlight, some of the areas where telehealth can benefit you, right, when it comes to looking at where it can fit into this new world of MACRA-based reimbursement. One area is with what they call the MIPS, Merit-Based Incentive Payment System. There's going to be 4 measures that they're going to be evaluating you on: quality, improvement activities, advanced care information, and cost. And as you can see, one of the big areas we really want to focus in on the improvement activities. This is a new category, right? This is a area where a lot of practices have really to get started, right, on what type of activities can they utilize in order to get credit for, the payment adjustment, or if you do what they call the advanced practice, you'll be able to get a payment incentive. So, we kind of want to highlight, some of the key areas there that, potentially telehealth and remote patient monitoring services can benefit there. High level, as you can see, the scoring for 2017 is transition year. So they're kind of looking at these 4 measurements. Really, cost measurement won't be looked at until probably 2018, according to CMS. But really, advancing care, which was MU, known as MU, and quality, PQRS, are pretty similar, but the new category is still there, and it's about 15% of your total score when you look at it. So it's something you need to kind of consider as you begin. 2017 starts in January, thinking about what data you want to submit in order to get credit for that measurement in that category. One high level advancing care information, one area that, you have about 15 different measurements you can look at. I think 6 are required. One measurement that you can look at also is patient-generated health data, right? Getting that data from outside of the hospital and from the clinic and be able to pull that into your EHR. So looking at remote patient monitoring solutions like Fitbits and different type of sensors that are out there and pulling that data in to get that health information. That could be something that you submit as part of your ACI information for MACRA MIPS. The other big thing, obviously, is the improvement activities, right?
With everything,
they have several different subcategories.
Sure
Each one of those improvement activities, and you have expanded practice access.
It
says so right here very clearly, use of telehealth.
Of that, the various rules regarding PHI still apply here. Security rules, administrative safeguards, physical safeguards, all of those things continue to apply in any way that you're handling any protected health information. And that is not, just because the patient's not with you, you want to make sure to remind you that that information is still covered. So you want to make sure you to vet your vendors, make sure they are HIPAA compliant, make sure you have your business associate agreements in place and ready for when you engage with someone, and make sure that they are as serious about protecting your patient's data as you are. So this is really similar to what I was just mentioning about the privacy rule, which again is that the same safeguards that you would take with a piece of paper in your office, and how you protect your local EHR. You want to have that same mindset when you think about whether that's monitoring patients remotely, whether that is using the video sessions and capturing notes, or using mobile solutions. Always keep in mind that the information is that patient's data is flowing across public lines, and so you want to make sure that you are using encrypted channels, and then also again working with your vendor to make sure that they are taking all of the necessary steps. This slide speaks to the business associate agreements. We have come across some clients we get to, and we have to give them our business associate agreement template, which is something that we want to make sure to let this audience know, to have your template ready, to have your agreement ready for the vendors, and so that is when you start the implementation, that won't be something that you'll have to deal with later, or have to scramble to get one created. There's several samples available. Maybe work with your counsel to get the appropriate paperwork ready to deal with vendors that are going to be handling your patient data. And this speaks to the business associate agreement. So I'll pass it back to you, Theo, to talk more about trends.
Okay, thanks. So I think overall, I think you guys know that with telehealth is really kind of following the trends that we're seeing in healthcare. Patients are living longer. The number of patients with chronic conditions is really growing. I think they said 177 million adults suffer from one or more chronic conditions. So it's definitely, something that's exacerbating over time. And we're seeing the need to kind of meet that delivery of healthcare more effectively, right? And the old way of doing it may not get it. These patients, like it says here, is definitely becoming costly. That's one of the reasons why Affordable Care Act was enacted and other, different ways of patients where they
Mr.
live.
Harvey,
So providing these kind of,
Dr.
remote telemedicine
Fennell,
services,
and
patient
Mr.
monitoring
Holmes.
services,
We're
and
now
kind of
open
really
for
lower the
Q&A from
cost
the
of
audience, but we
healthcare,
do
right,
have
over
some questions
time, and really
currently
make it
in
more
the
effective for the
presenter
patients.
Q&A pod, so
And
I'll
then great
share
is
those
becoming,
questions with you.
greater
And
acceptance,
if
that
any
we're
of
seeing
the
more around
participants
the
have any
patient
questions, feel free to
population.
submit
I
those
mean, we kind of talked
into the
about it,
presenter
right?
Q&A pod.
Everyone can kind of get
Question one,
what they want
how
with
can you
just
tell
a
if
single
your
smartphone
vendor
device, right? And
is
the ability
HIPAA
to kind of have the
compliant?
same kind of services available for healthcare. I think it's going to be key for the future.
That is a good
So,
question.
definitely being in the forefront of that, and
Typically,
CMS gets it, right? That's why they
vendors
baked
have to have
into
certain
MACRA
documentation
MIPS and
of
some of the
their
other innovation
processes, their procedures.
services that they
They
kind of
must go
provide,
through
room
certain
for telehealth, right? To
exercises.
say, hey,
Some
these services
may
are going to be
have
needed, and even more so in the future.
certain
So I look forward
certifications
to like more
that
reimbursement models.
if
They're
they
already
have the
talking about
certification
different
that
ways of
proves
how
that they've already
next
gone through
generation
all of the
ACOs
steps.
are looking at
But
providing
in
telehealth
general, I would
services
ask
that are
to
reimbursable.
see a
So
sample
there are ways
of
that they're
their
looking at to
processes
kind
and
of make it
procedures,
more, give
and
more incentives for practices,
typically,
try these innovative
and
ways
also maybe the
of delivering
outcome of
healthcare
some of the
at a lower price point
exercises, like for
while
example, a
keeping the
beach
quality
exercise
up.
a
So, with that being said, I
business
think we kind of
continuity
covered everything
exercise.
within
And
that.
some may
And
be a
so we
little
kind of leave it
hesitant
open for Q&A for the
to
last 15
share
minutes.
much proprietary
Definitely
data.
thank you guys for
However,
your
they may
time.
send
And
a
if you have any
screenshot or a
questions,
sample page,
we look
or
forward to hearing from you.
they will send some proof that their organization does adhere to various parts of the HIPAA guidelines. So basically asking for documentation, and also if you plan on having a long-term relationship, hopefully with that vendor, then it's something that you would set up on a yearly basis perhaps, that you would check their certifications, ask them to submit the outcome of their yearly audits, even if it's a self-audit. But you would want to see their risk analysis, but make sure you ask for documentation and keep a record of it.
Thank you, Mr. Holmes, for such a detailed answer. Our next question is regarding the implementation of telehealth strategies. Have you realized positive revenue? So that's open to all presenters.
On my end, I have had a really nice reaction from patients and in my own self for revenue. And what it does is it makes it so that we're able to reach out to the clients more often, as well as being able to work around what their schedules are. So when I normally, patients need weekly or even twice a week therapy, they can't physically get here that many times. Being able to have a telesession available makes it so that on my end, I'm getting paid more because I'm seeing them more often, but on their end, they're also getting treated and serviced more often as opposed to having to wait. And then also they're seeing better improvements in that, because if we can increase their sessions as well as their goals and stay more compliant, they're going to get better sooner, which is also, ironically, is also going to help my revenue, because it's going to make it so that in turn they're going to send more people to me. They're also going to feel more comfortable coming to me more often.
Yeah, I definitely feel that, some of the reimbursement models are a little bit restrictive. And I know there have been some questions about, what are some ways for practices to, make it profitable. I definitely feel that chronic care
I want to
management,
add to the
piece is
operational
a step in the
efficiency
right
part, just
direction,
with
but
the
obviously
example
implementing
of one of our
it
customers
could be a challenge, right?
that
You have to sign
mentioned
up your
is a
patients,
surgeon,
and
and
that
actually
copay
some
may
of
be
his
restrictive for them.
follow-ups don't
So definitely there are
require
innovative
any
ways to
touching.
implement
They don't
telehealth, right,
require
to
him to
make it
really check
feasible
much
to
other
be
than to
to
speak
make
to
it
them,
profitable
ask them how
for
they're
you over
doing it.
time. I would just say,
And
you have to look at not just the
his great
reimbursement,
idea
but the
was that
operational efficiency
instead
that you
of
can
using up
gain,
one of his
right? Having
rooms,
staff
one of his
available
exam
via
rooms,
virtual visits,
he
right?
would
Saving
schedule these
costs.
patients
For
throughout
instance,
the
if the
day, which
patient
would then free
misses
up more
sessions all
real
the
estate
time, is
to
messing
fill
up their
that
care,
room and thereby get more
ability to
revenue
kind of
that
have
way.
that video
So that's
telehealth
just
session
a
for a fee,
small
right? As
example
opposed to them
of
coming
how
in,
some
wherever they're coming in to do that initial
providers are
visit,
using
could be
telehealth
something
to
that they'd be willing to pay
affect their
for.
revenue.
So So there's a lot of different
And
technologies
also
out
with
there, right, that to
insurances,
kind of
you
make it more
can call
profitable.
the
And we
insurance
definitely work with
specific to
clients
that
who
patient
looking at various
and try
different
and
ways
set
to
up a
kind of
treatment plan with
meet
the
the
insurance
needs.
company
I would
as
just say in
to
this
how
new
many
world
telesessions you
of
can have available because
MACRA
of
and quality
whatever
based
situation
payment,
it is that's preventing that
you
patient
definitely
from
want to look
coming
at
into
ways to
office.
kind of
So that
effectively,
makes the
meet the needs,
reimbursement a
because if you're
non-issue
going to get like a flat
because
sum fee to kind of, meet the needs of
it's
the
already
patients
been
from a
agreed
healthcare
upon on
delivery,
what your
the
rate
goal would be
with
to
that
lower that,
insurance company,
cost
what
of
that
delivery
rate
as
is
much as
going
you
to be.
can
I'm
and
out
still
of
keep the
network,
quality up.
so
And
it makes
telehealth
it
can
so
meet
that
that
I
as
am
well by
able to
getting
come
those
down on my fees
operational
and work
efficiencies
still
over
with the
time.
person's insurance in an out-of-network format, which is extremely convenient for the patient, and they know exactly what they're looking at up front.
Thank you very much. So we're moving on to the next question. So this question is for Dr. Fennell, or actually it's open to all of you from your diverse perspectives. Do you find that it helps you to reach treatment objectives, the implementation of telehealth in practice?
I think that, and I've mentioned it a couple times, I think that it does help you reach your treatment objectives because it allows the patient to be able to be more compliant when we're in, I think, a day and time where people have a hard time making time for health issues, period, but especially mental health issues. I think it also, because there's options now with devices that can monitor heart rate, monitor breathing, body temperature, that kind of thing, it also makes it so that when we set treatment goals and we have concrete goals on where you will see improvements and how to impact your body and how to change your physiology and how that impacts your mental health, I think it's right in line with all that, and it makes it so that I'm able to be with people when I normally wouldn't be able to.
Thank you. Again, we are open for Q&A, so if any of the participants have any questions or additional questions, feel free to add those to the presenter Q&A pod. Dr. Fennell, Mr. Harvey, Mr. Holmes, thank you so much for a very informative presentation. And if you have any additional questions, you can contact Georgia High Tech or Sensor Med. The contact information for both organizations are provided on this slide, and the webinar presentation and an archive video will be made available to all persons who registered for the event. On behalf of Georgia High Tech, we thank you for attending today's webinar, and we thank each of the presenters for an informative and educational presentation. Again, you can connect with us at www.ga-hightech.org or via Twitter at Georgia High Tech. And again, we thank you.
Thank you.